Hey guys, here's our presentation on Rett syndrome.
Retts is a neurological disorder that presents primarily in female children. There are 4 stages of Retts syndrome development. Stage 1 presents as typically developing from birth until 6 to 18 months old. Stage 2 includes delayed motor and communication development and the development of stereotypic or repetitive movements and a loss of purposeful movement. Stage 3 is a stagnation period from ages 2 to 10, where some recovery and gain of secondary ability occurs. Stage 4 is a return to a reduction in mobility skills, while communication and cognitive skills remain the same. Typical symptoms of Retts include severe intellectual disabilities, speech delays, decreased motor development, including impairments to grasp, coordination, and motor planning difficulties, and low muscle tension. Some other symptoms include the presence of repetitive hand movements, cardiac and breathing abnormalities, and social behavioral problems. The severity of these symptoms varies based on the type of genetic mutation that is present. Almost all cases of Rett syndrome are caused by a mutation of the MECP2 gene on the X chromosome. The MECP2 gene plays a large role in the regulation of other gene expression and therefore results in developmental abnormalities. Although Rett's is a genetic disorder, most cases are not inherited and are more commonly caused by spontaneous mutation. Rett's is a rare disorder that occurs in 1 of every 10,000 to 15,000 live female births in all racial and ethnic groups.
So the typical profile of someone with Rett syndrome includes physical and cognitive behavioral symptoms. Some people have reported a pre-onset stage before the age of 6 months, where the infants are seen with some mild hypotonia. That would lead on to early onset stage between ages 6 and 18 months. This includes stagnation in head, foot, and hand growth, as well as full-on hypotonia, as well as developmental delays, lack of interest in things like play and socializing with other people, which is really big for these guys, as well as loss of adaptive behavior. Then it moves on to the rapid destructive phase, which is where everything just starts going backwards, essentially. And this is between ages 1 and 3 years. So there's a loss in deliberate hand movements, which gets replaced by stereotypical hand movements such as hand washing, hand mouthing, and clapping. Some may experience seizures as well as trouble sleeping. Then there's a regression in development, which can include irritability, self-injurious behavior, as well as loss of language. Then it moves on to the pseudostationary phase, which is just a worsening of symptoms at this point, where a child may experience ataxia, which is the muscle coordination, apraxia, which is motor planning difficulties, spasticity, hyperventilation, and wakeful apnea, which is where they stop breathing during the day instead of at night, as well as scoliosis. This can also include severe developmental disability and teeth grinding. This finally moves on to the late motor deterioration phase, which is 10 years and over. This is just a much slower decline than what we saw previously, which is decreased mobility, slow growth, and lessening of seizures, which is good, but it also includes improved social contact. Some strengths that kiddos with Rett syndrome have are the ability to learn adaptations, whether it's within occupations themselves or learning how to use adaptive equipment. They can communicate through various means, including the AAC device that you see on the side there. They can understand speech and different concepts, and they can express their emotions. Some needs that they have are moderate to max physical support for mobility and occupations. And some other health problems that they may experience are scoliosis, where the C-curve type is the most debilitating versus the S. They may have trouble sleeping, seizures, have respiration problems, which is where the wakeful apnea comes from, as well as digestion and feeding and eating.
So, impact on function. Rett syndrome could cause the individual with difficulty or inability to speak. Those with Rett might have some social behavioral problems like Maggie discussed, which can lead to decreased social participation. It could also limit social participation since those with Rett syndrome demonstrate autistic-like tendencies, so depending on how severe the symptoms are presented, this could limit them from making or maintaining relationships. Their inability or difficult speaking would lead them to decreased social participation as well. They may also have difficulties with motor planning and coordination, which could include ambulation. Difficulty walking would have an impact on function as the child would not be able to participate or play the same activities as their peers, and play is such a big deal when you are a kid. Hand dexterity could be an impact on function as well since it is a main focus within OT. Grasp and manipulation may be impacted due to Rett syndrome, which would decrease independence in IEDLs such as handwriting. Cognition would also be impacted, and the cognitive delays may interfere with their ability to complete their schoolwork. The role of OT is also important in Rett syndrome. The OT will work on increasing hand function as well as motor planning and coordination, eye tracking, and splinting. I found articles that specifically talked about eye tracking technology for communication as well as elbow restraints for those with Rett. The article discussing the eye tracking technology was created due to the fact that many individuals with the diagnosis have trouble speaking. Those with Rett experience loss of speech, decreased hand use, and severe motor apraxia, which significantly impact functional communication. Eye tracking is a worthwhile and satisfactory piece of technology that can be used for these individuals as well as an AAC device. The OT may team up with an SLP when using this type of an intervention as well. The researchers reported that 10 of the 11 families in this study felt like they had seen progress in their child's awareness, engagement, expressiveness, and understanding of language since using the communication technology. The article on elbow restraints again brought up the fact that many children with Rett syndrome were originally diagnosed with autism. This could be due to the fact that these children seem unable to break out of the characteristic hand stereotypes, which may include making hand-washing movements, wringing their hands, licking, and sucking their hands. This article also states that elbow restraints reduced hand biting as well as other hand stereotypes. They also increase finger feeding skills, which is an OT intervention.